All right, good afternoon, everyone. Welcome to another edition of Wellness TV. This one is called Understanding Chronic Pain. And this is actually a first class in our series, pain management series, Explore the Pain Pathway. So for those of you tuning in via Wellness TV during our normally weekly webinar series, this is actually the first class in our four-part series. So if you are interested in joining this series, if you're a Jacksonville member, you will get Gator Care member, you will get 100 points towards your wellness credit. So that will fulfill that extra 50 points that you need for that. You can register on the bridge, or it's included in our weekly emails. For our Gainesville folks, again, you can, it's been included in your Wellness Weekly emails as well from your Gainesville office. And anyone can join. They will be available all virtually. And we also will record each of the sessions so that we will be able to, if you are unable to watch it live, you will be able to have the opportunity to watch it on demand, as well as we'll send a copy of the presentation upon conclusion. But if you do, this is a very broad overview of the chronic pain. We'll get into more of the nitty-gritty details in the program, kind of create some lifestyle changes for you as well. So if you're interested in joining that program, the way you'll be able to get those links for the future series is by signing up for the program. Each class will take place on a Thursday. So for the next 4 weeks, Thursday at noon. But again, we will have the option of watching the recorded session as well. So part of that participation, to get your participation credit, we will send a post-class assessment that you will be able to answer. Again, nothing too detailed. It'll be about 3 to 5 questions each after each class. But again, my name is Nick Tennant. I am a health educator in the Gator Care Jacksonville office. Today, we're going to be talking about understanding chronic pain and really going into the different types of chronic pain, as well as the causes and symptoms they may have. So when we really look at the program as a whole, we are going to look at different things. So today we're really going to be able to describe the different types and effects that chronic pain may have on you and kind of distinguish between acute and chronic pain. What do they mean? How do you know which one you are experiencing? Now, later in the program, you'll be able to learn to manage your pain through different lifestyle changes you can create for yourself and discover and learn about the resources that are available to you that can help you through that process. We'll also have a class on medications, their side effects and their potential side effects, and then alternatives to those medications that you may be able to implement as well. And lastly, to round out our program, we're going to have you develop some SMART goals. These are measurable and attainable goals for you guys at the end that you can carry with you. And we'll check back in with you and make sure that you're following up with your goals to help alleviate that pain that you may be experiencing. But before we get too much into the different types of chronic pain and the symptoms and some of their causes, let's look at chronic versus acute. So most of us have probably experienced pain at some point in our lives. We may be even experiencing some type of pain right now. So it's not necessarily a rare thing. In fact, there's over 100 million Americans that experience chronic pain, and that costs over $560 billion. So that would include absenteeism from work, loss of productivity because of that, and the healthcare costs associated with chronic pain. So as you can see, it's not necessarily a minor issue or something that is not very prevalent. So when we talk about chronic pain, that is really considered a disease itself. Okay, when we talk about acute, it's more sudden. It's often results from an injury or inflammation or from disease, but chronic pain is really considered a disease itself. So as we go through the differences of chronic pain and acute pain, remember, acute, you can kind of trace it back to its origin. Chronic pain, you may not always know the cause of that chronic pain, but it's really considered a disease itself. So when we look at acute pain, I want you to think of it like the megaphone of your body. So when we talk about acute pain, we are really talking about an event that is triggered by tissue damage and designed to protect you from further injuries. So when we talk about acute pain, I want you to envision yourself out on a field, you're having a barbecue, you're laying out for a picnic, and a bee comes and stings you on your arm. That reaction that your body has is your megaphone telling you, hey, I'm hurt, this is where it hurts, let's try to prevent further injury. So again, acute pain is that sudden pain or something that is not necessarily prolonged. You can pinpoint the reason. It's generally from illness, injury, or surgery that you may have had, and you typically know exactly where it hurts. So this would be a toothache, like I said, a bee sting, or a broken bone. But the important thing with acute pain is that with time and treatment, that pain usually subsides and goes away. So acute pain is your megaphone, your body's megaphone, letting you know, hey, this hurts. This is where it hurts. You can trace it back to the event, and with that time and treatment, that pain will actually subside. So that differs from chronic pain, and that's really what we are going to be focusing on in this program. Chronic pain is that persistent pain, that pain that doesn't go away even after the injury is healed. We typically say chronic pain is pain that lasts 3 or more months. So again, with acute pain, you may have a toothache due to a cavity, but once you have that cavity filled, that pain actually starts to subside. So you treat that acute pain. With chronic pain, that pain may persist even after treatment is completed. So we're going to take a look at the different causes of chronic pain and some of the types of chronic pain, but know that sometimes you can experience chronic pain and there not be a definitive reason as why you're experiencing. It can also either be a constant chronic pain, or it can kind of arise and fall and come out without warning. So it's not necessary. It could be very sporadic. And it can also occur without any indication of injury or illness to even take place. Like I said, with that acute pain, you can usually trace it back to a specific event, surgery, injury, illness that you have. Chronic pain may not be as clear. So we're going to talk about the different causes of chronic pain, some of the theories out there, and also the different types that you could be experiencing. So when we talk about causes of chronic pain can be caused by a number of things. It can be caused by chronic conditions such as arthritis. That causes like a painful inflammation in your joints. In other instances, it may stem or linger from a surgery that you may have had, or injury or affection that you may have experienced. When we talk about neuropathic pain, that's pain that stems from damage or peripheral or spinal nerve rather than just the healed injury itself. So once that nerve is damaged, your brain will send it will send unwarranted pain signals to the brain. So what I really want you to take away is chronic pain. There's a lot of different causes that can cause it, but it also creates this cycle in our life that we're in pain and then it activates our stress. So we're stressed that we're in pain. Stress can lead to depression, back to pain. So it's really this vicious cycle of chronic pain, stress, and depression. So it's important to be cognizant of our symptoms and also work with our doctors and try to create some changes in our life to help alleviate that pain. Now, when we talk about sensitization, that's really when pain signals are transmitted from an injured or diseased tissues to the brain. So those signals activate pain circuits in other locations of the body. So this can kind of help explain why we may experience pain that's more severe than the actual injury itself. So the severity of the injury may not be as painful as the sensitization that is occurring that we may be experiencing. But we talked about some of the causes, and we'll go into specific causes with the different types of chronic pain. So let's go to one of the most common types of chronic pain that we may be experiencing, and that is arthritis. And chronic pain can really affect any part of our body, and arthritis can really affect any part of our joints. So it's joint inflammation usually caused by injury, physical inactivity, so not being active enough or exercising enough throughout the day or throughout weeks, natural wear and tear on the body, or genetic disease. So symptoms you'll usually feel are pain, stiffness, swelling, decreased range of motion. Those types of symptoms are what you're experiencing. Now, of all the people that have arthritis, about half of them have what is called osteoarthritis. So this is a condition that usually occurs when you turn 45 or older, and it does occur in both men and women. So what happens is the cartilage that usually cushions the bone and joint deteriorates and sometimes causes pain from that bone-to-bone rubbing. So osteoarthritis is very similar to like the brake pads of your car wearing down. So when that happens, your body will actually try to fight it, and try to repair itself, but oftentimes it's not very successful at doing that, and it can actually create what is called spurs from those bone-to-bone rubbings. So that may be little bumps and bones protruding from along the sides of those existing bones. So you may see those lumps form, usually in your hands and wrists and feet, um, or hands and feet, and they're usually called, like I said, they're called spurs, but the reactions to them may differ from person to person. So some people may feel that pain and tenderness, while others may not. But again, this is a very common type. Again, it differs from person to person, but that can create that lingering pain and tenderness. Another common form of arthritis is called rheumatoid arthritis. So this usually develops between the ages of 20 and 50, but it does affect women twice as much as men. So this is thought to be caused by an immune system disorder. And what that immune system disorder does is it attacks the lining in your joints. So white blood cells move into joint tissues that produce inflammation and pain. And the swelling of these tissues releases natural chemicals that will damage your cartilage, tendons, and ligaments. So over time, your joint will actually lose its shape and can be destroyed. So this is commonly found in joints in your wrists, hands, feet, and ankles, but it can persist in other joints as well. Now, one of the most common types of chronic pain is back pain, and this is one of the leading causes of absenteeism or missed time from work, and one of the leading causes of healthcare visits nationwide. And for those of us working at home or working in the office, this is a very common type of pain that we may be experiencing. So when we talk about acute back pain, like I said before, it's usually sudden, but you can usually trace it back to an event. So think of acute back pain, maybe you tweaked your back after a heavy day of moving. So you're moving out of your house and you feel that pain because that lower back serves as the pivot point for our bodies, and it bears the most of our weight. So it allows us to bend over, move side to side. So obviously having that pain or having that injury there can lead to that pain that we may be experiencing. And when we talk about chronic pain, these are just some of the reasons you can experience chronic pain in the back, but obviously it's not all inclusive. So when you have muscle strains or spasm, this usually occurs when you lift something too heavy or twist too sharply, but it can also occur for just standing long periods of time. For those of us that are on our feet for long periods of time, excess body weight can also lead to that, and poor posture as well. So when our back muscles strain, our muscles actually have a spasm as a result. Again, this is the body's defense mechanism. It's meant to immobilize us so it can prevent further injury. So we don't go on and injure it as further than what we already have. So most of these cases do go away, but some do linger indefinitely, and that can cause that chronic pain. Usually the more pain you have, it's more likely the more spasms you will have as well. Looking at sciatica, this is a pain that radiates from your back down through your buttock to your lower leg. So it could be caused by inflammation or compression of a spinal nerve roots that merge to form your sciatic nerve. So usually in this type of pain will go away on its own, but severe cases will cause that pain to last indefinitely. Lastly, herniated discs are caused by injuries, or in some cases, it's just the normal wear and tear, in which the disc between the bones in your back bulge or rupture. So bulging discs, you may have heard that. It's very common for people 40 years of age or older, and most people are not bothered by them. The rupture will heal over time and that pain will eventually subside. However, in some cases, as we talked about with chronic, it can linger and that pain can persist. Another common type of pain, especially for us office workers, again, neck pain and overuse strain injuries. So when we talk about neck pain, this is really a major culprit, like I said, of those of us in office jobs, working at home. We can get this simply by hunching over or leaning into our computer screen at work, poor posture. Usually this pain only lasts a few days, but without proper attention, this becomes a chronic problem. So neck pain can also be caused by herniated disc or osteoarthritis. So the bony surfaces in your neck slide across each other, and that can produce friction, and that will cause us pain. Overuse strain injuries are exactly what they sound like. So these are injuries that result from the overuse of your muscles and tendons. So you'll usually experience these in your hands, wrists, and arms. Common example of this is carpal tunnel syndrome, which causes inflamed tendons due to the constant use of your wrists. So those of us on computers and doing that, we might have experienced this as well. So other examples of overuse strain injuries may be golfer's elbow or tennis elbow. Usually the symptoms include numbness, tingling, or pain in the affected areas. Now, phantom pain is an interesting type of pain. This is pain that you may feel from a body part or limb that is no longer there. So this usually occurs in an arm or a leg that's been amputated, but it's not limited to those body parts. But the theory as to why this may occur is due to the fact that the brain is sending mixed signals. So once that body part is no longer there, your brain will actually remap the sensation from that body part to other parts of your body. So that's why you'll feel that pain. Headaches. I'm pretty sure all of us have experienced a headache at some point of our life. Some of us may be experiencing them right now as we are working. They range in their pain, so they could just be a nagging annoyance that you have throughout the day to a debilitating pain that really prohibits us from doing anything other than just laying down. So we'll look at the two major types of most common types of headaches, and those are tension headaches and migraines. So tension headaches are the most common form of headaches. So they're usually triggered by stressful events or situations in your day-to-day life. So for example, if you drive in Jacksonville, I don't know if it's the same for Gainesville folks, but when you drive in Jacksonville, it's a pretty stressful situation. There's not a lot of great drivers in Jacksonville. So just driving to work can trigger those um, tension headaches, maybe having a demanding job as well, or getting in an argument with loved ones. Any of these types of things, these stressful events can cause tension headaches. But these types of headaches can also be caused by just staring at our screens all day. If we're at work, staring at our computer all day, we come home, we stare at the TV, our phones, we can these can trigger those tension types of headaches. So the symptoms of tension headaches are that throbbing and pressurized pain that usually targets your forehead, your scalp, the side of your head, and the back of your neck. So again, the severity obviously can fluctuate. It can range from minor to severe. But that constant stress or prolonged screen staring or incorrect posture, any of those things that we talked about can cause that to be a chronic issue. Now, migraines, on the other hand, these are usually the more painful or severe type of headache. These are the types that really can render us immobile. So they're thought to be hereditary, but can be triggered by things like hormonal fluctuations, diet, our environment, our lifestyle, or just the medications that we may be on. So migraines are typically known to have that throbbing pain, again, usually near our temples or forehead. So these can be quite severe, as I said. So any stimulation, that be lights, noises, um, strong smells, loud sounds, things like that can cause that pain to intensify, and in some cases can cause nausea and vomiting as well. Now, usually migraines only last for a few hours, but they are typically more severe than tension headaches. Women are 3 times more likely than men to be affected by the migraine. Hormonal fluctuations may cause females to experience migraines, as well as some estrogen and some birth control. Diet is another big factor for migraines. So if we're consuming a lot of alcohol, if we're eating the wrong types of foods, unhealthy foods, if we're going long periods of time without eating or withdraw from caffeine, all of these can trigger those types of headaches. Also, a lot of the lifestyle choices and habits can contribute to migraines. So if we are constantly stressed, if we are have poor sleep habits, or we are always physically inactive, we're not getting enough exercise throughout the day, all of these types of things can trigger a migraine. Now, when we talk about environment triggering a migraine, these are usually due to those strong smells, loud sounds, weather changes, or bright lights. I won't touch too much on medications. We'll have a whole class dedicated to medications, but They can sometimes be the culprit for migraines. So certain blood pressure medications or birth control can elevate the risk for one in susceptible people. All right, we'll move on to fibromyalgia. This is a collection of symptoms that are widespread and chronic, obviously. These include pain, tenderness, fatigue, sleeping disorders, and anxiety. So they can really coexist with other disorders or conditions, such as arthritis, for instance. So the most common symptom that you'll experience from fibromyalgia is usually pain and tenderness throughout the body, combined with fatigue. But other signs can pop up, like you could have digestive problems, numbness, stiffness, tingling, headaches, dizziness, and sensitivity to different medications, food, or weather changes. But since fibromyalgia does not follow your typical pattern, there has not been a specific cause that has been determined. Most often, you'll start to experience these symptoms in your 30s, and these can kind of disappear and flare up indefinitely. So although they may never go away, the symptoms may never go away with fibromyalgia, they are not life-threatening. Theories do suggest that a combination of factors can cause fibromyalgia, such as an increased sensitivity to pain, you have undiagnosed sleep disorders, you've had some past injuries, the medications you're on, or changes in muscle metabolism. So mouth, jaw, and face pain or orofacial pain is usually caused by dental problems. So complications due to cavities and gum disease are the most likely culprits, but there are other causes too. So the temporomandibular joints that help connect your jaw to your skull, those disorders include symptoms to these joints in your face. So exact causes are not really known, but theories include some type of muscular damage around those joints or trauma and degradations of the joints themselves. So the symptoms you'll feel when you have this are pain in the face, jaw, neck, or ear, and you'll also have headaches or the jaw locking or catching. Oftentimes people will hear or experience the clicking of their jaw. Now, burning mouth syndrome usually affects your tongue and lips, and it will create like a burning sensation in your mouth. So females, again, are 7 times more likely to experience this type of pain, but it can be caused by a number of things such as chronic conditions you may have, medications, some hormonal imbalances, or acid reflux. Now, trigeminal neuralgia occurs when a blood vessel comes into contact with your trigeminal nerve, and it causes that pressure that feels like an electric shock to the face. So it can really occur spontaneously, and it lasts anywhere from a couple seconds to upwards of a couple minutes. So this usually reoccurs throughout the day, but simple things like touching your face or brushing your teeth can also trigger it as well. So it's definitely a very painful condition that is very sporadic as well. Now, one of the less common forms of chronic pain is something called complex regional pain syndrome. So this usually affects an arm or a leg. And an injury or trauma can trigger a variety of painful symptoms, but it's not only at the injury site. It actually causes pain in adjacent locations as well. So the pain that you experience if you have complex regional pain syndrome is actually very much more beyond that of the original injury. So it's much more severe. This pain usually occurs after a forceful trauma, so something like a crush or a fracture. But emotional stress can be linked to this as well. Now, there are 2 types of complex regional pain syndrome. There's type 1 and type 2. Now, type 2 is the most common. About 90% of people that experience complex regional pain syndrome have type 1. So this is an injury that occurs when the nerves are not directly damaged. Type 2, on the other hand, is much more severe, and it's a result of direct nerve injury. So the symptoms of complex regional pain syndrome can include swelling, pain, and blood flow change of the affected area. The symptoms do eventually go away, but they can persist for years. So I know I went over a lot of information, a lot of different types of chronic pain. We by no way or no means covered all the different types of chronic pain. There are several out there, and we hope that you'll join our series to kind of experience that and take a deeper dive into the types of chronic pain. Like I said, the changes that can help you with that, alleviating that pain, some of the medications, if you have questions of your medications, that's a great class to join as well, and alternatives to medicine that you can take as approach as well, and kind of creating those lifestyle changes as we said. So from this presentation, I want you to remember that the persistent pain that does not go away after an injury is healed is considered that chronic pain. So it's that chronic pain. Remember, acute is that sudden pain, your body's megaphone of letting you know, hey, I'm hurt, this is where I'm hurt. Chronic pain doesn't necessarily always have a reason, and it's that lingering pain that is indefinite or at least persists for 3 or more months. Also, chronic pain, as you saw here, can affect really any part of your body. So it's important to know your symptoms, to work with your doctors to come up with a plan to help alleviate that pain. So if you are enrolled in the class, I want to remind you that you will be receiving a post-class assessment to complete. Again, it's not very long, but it will count towards your participation in this course. You also receive a copy of the presentation. So any of you guys that are interested in signing up, Jacksonville members, you can go out to the bridge and sign up, or check our weekly wellness emails for a link to sign up as well. Once you sign up and watch that first lecture, if you just watched it here today, we'll go ahead and send you that post-class assessment to fill out as well. Again, Jacksonville members, you guys can get 100 points towards your wellness credit. You only need 50 of that this year, but that will fulfill that extra requirement that you need outside of the flu shot and the personal health assessment. And Gainesville members, you are welcome to join as well. You guys should have the link in your wellness emails from the Gainesville office. So our next class is next Thursday at 12. We'll learn to implement different effective lifestyle changes on our own to help lessen that pain. So hopefully you guys got a good broad overview of chronic pain, the different types, what to kind of expect from this class. If you are interested, by all means, we would love to have you, and we'll have some great topics to discuss with some great presenters that are really experts in this field for you guys. So if you have your questions that you really are burning in your mind, really join our classes, join this series, because we'll have some great speakers. All right, and I'll hang around if there are any questions. I do try to advise you guys, if it is personal health information, try not to share it in the chat box. But general questions, by all means. If you would like to email us different questions, you're more than welcome to do that as well. All our contact information is on the bridge as well. So thank you guys for joining. I'll hang out if there are any other questions.